ADHD, anxiety, and addiction. How are they related and what can you do about all of them? I'm Dr. Trish Leigh. Let's break it down together. First, we're going to talk about the ADHD brain pattern. What does it look like? What's happening in the brain? Then we're going to talk about the anxiety brain pattern. What's going on there? Then we're going to talk about how addiction serves those two brain patterns. So secondly, how do addictions serve the ADHD and anxiety brain pattern? Then third, we're going to talk about what you can do instead. Stay with me till the end of this video because I always give you a bonus brain tip, and today's is awesome. Okay, so let's get started. What does the ADHD brain pattern look like? It is a brain that's using excessive slow processing speed. So what that means is it's basically in fall asleep mode. That mode is called theta, and it goes at 5 hertz, 5 cycles per second, very slow, and it's making the brain feel groggy and tired. So the behaviors that it gives you is lack of focus, you become distracted, you are looking for stimulation if your brain is running this slow. So the ADHD brain pattern craves stimulation in the environment, either externally or internally, to keep it alert and engaged throughout the day. Now, down here on this side of the continuum is the anxiety brain pattern. It is cranking away 25, 35 hertz. It's going very, very fast. It's overdrive mode. This brain pattern needs to be calmed down because it's cranking way too fast. Now, we know that ADHD and anxiety are comorbid, it's called. They exist together many times. And the reason that happens is because a person is born with an organic ADHD pattern. It's there since birth. It's called a neurodevelopmental disorder. Now, if it's there since birth, it means your brain's running too slow and it's falling asleep. It needs stimulation. So for many people, they either seek that stimulation out in the form of drugs, alcohol, behavioral addictions like gambling or video gaming or using their screens for other purposes. So what happens is they're getting that stimulation from the electronics or from their behaviors or substances. Now, at the same time, that brain might be seeking internal stimulation, which is anxiety or worry. So what happens, and the reason the patterns are comorbid, is because the brain's running slow and it automatically kicks it into overdrive gear, this extra fast mode, to offset the slowing. So now you have internal stimulation of anxiety that feels the need to be calmed. When the brain's running extra fast, it has to be calmed down and soothed. So many times people will look for drugs or alcohol or behavioral addictions to soothe their brain and their nervous system too. And for many people, they're doing both. And what the addiction does is it calms their nervous system, stimulates their nervous system simultaneously. And we know what happens in an addictive cycle is it's actually the craving or the planning of going to engage in the addictive behavior that starts to create this neurochemical rush in the brain that helps it feel stimulated and calmed simultaneously. And that's why addictions are so attractive to people with ADHD and anxiety, and usually they have both. Now, if you're following me, it's because an optimal brain pattern is operating here in the middle, 12 to 15 hertz for calm, relaxed focus. If your brain feels calm and relaxed and focused, it doesn't need to look for external sources of soothing and stimulation. So people who have an optimal brain pattern are far less likely to seek out addictive behaviors. Okay, so now what do you do about it? Well, science shows the best recovery programs for addiction also involve finding out if a person struggles with ADHD and taking care of the ADHD or the anxiety simultaneously to the addiction, because the ADHD brain pattern is the driving force for the addictive behavior, if you're following me. That's why neurofeedback brain training is now a pivotal aspect of inpatient recovery programs across the country, because we have to get to the root of the problem, which is the ADHD and anxiety brain pattern. So the way that it works is if you have neurofeedback brain training, you can teach the brain, basically, it doesn't put anything in. You teach the brain to make less and less and less of slow speed, less and less and less of fast speed, and more of perfect processing speed in the middle. As the brain is decreasing these speeds out here in the extremes and is bumping up that perfect processing speed, there's no longer a need for the addictive behaviors. And that's how you can have long-term success fighting addictions, getting right to the root and the cause of the problem in the first place. Okay, now, if you're finding value in these videos, please consider liking and subscribing because it can only help us both. Now let's get to your bonus brain tip. Here it is. I want you to think about yourself. I want you to think if your brain needs stimulation or calming, or both. So think about that. Do you think your brain needs to be calmed down more? Does it need to be stimulated and excited more? Or do you have kind of that combo pattern? Now I want you to think about what you're currently doing to give your brain what it needs, because our behaviors all serve what our brain needs. So what are you doing to serve the need? Is it healthy or is it unhealthy? There's healthy ways to serve those needs in the brain. In the meantime, if you have a very big ADHD pattern in there, you likely want to have neurofeedback. But for all of us, all of our brains at some times seek stimulation or seek calming. So now what I want you to do for your brain tip is I want you to take an unhealthy behavior, like drinking every night, and substitute it with a healthy behavior of reading every night. Now that switch is not going to happen overnight, but you can reboot your brain to no longer do your unhealthy habits, but you need to do habit replacement and put another habit in place that serves the same need of your brain. So you have to figure out, does my brain need to be stimulated? Does my brain need to be calmed? And that might vary across the day. So if you've watched some of my other videos, I'm always talking about my brain health program, where I try to, when I'm the best version of myself, which doesn't always happen, but when I'm the best version of myself, I follow a pretty, it's flexible but consistent routine where I work out in the middle of the day every day. I spend time cooking in my kitchen and playing vocal jazz radio or something, Italian cooking music, something like that, that calms my nervous system while I'm making lots of healthy food. Then in the evening, I'll go for an evening walk around my beautiful neighborhood. Those are all things that stimulate and calm my nervous system throughout the day as it's necessary, with a really nice routine of having my nervous system on and then giving it breaks. So I challenge you to do that for yourself today. Okay, so I hope this helps you out. And remember, control your brain or it'll control you.